Hi everybody, I'm Dr. Jonathan Fu coming back live to you. Good evening and welcome back to the second installment of our Facebook live stream on colorectal cancer awareness. Great to be back live and thank you for joining us today. Now, today is day 21 of the, if memory serves me right, of the circuit breaker. I trust everyone is doing fine, staying at home. Now, the biggest priority for everyone at this point in time is to keep you and your family safe. I sincerely hope that that is the case and remains the case during this period. For those who are continuing to work in essential services, I thank you for your service. Stay home, stay safe, stay healthy, and we will get through this. And as before, once you are in, do give me a shout out by typing in and let me know that you are here. Now let's have a quick look and see who's come in. Hi to Felicia. Hi there, Tony. Evelyn, Serafina, thanks for joining in. People continue to stream in. Now, for those joining us for the first time today, a big warm welcome. A bit about myself. I'm Dr. Jonathan Fu. I'm a senior consultant general surgeon with FAM Surgery. I specialize in colorectal surgery. Now, the bulk of my work involves scopes, laparoscopic or keyhole, and robotic surgery, and procedures for the back passage such as PALS and fissures. The full video for my live stream last week on colorectal cancer awareness is just a click away on the FAM Surgery Facebook page. Do head over there to catch it if you've not caught it during last week. So what did I touch on last week with everyone? We covered what Singapore's #1 cancer was all about. We debunked the myths surrounding the cancer, highlighted when to be concerned and when to see your doctor, even during this circuit breaker period, and what diagnosis and treatment involves. And we also had a cancer survival, Mr. Alil, demonstrate that a cancer diagnosis does not mean the end of the world. But more importantly, and I cannot overemphasize, what was the crux of the talk was the importance of screening through the gold standard of going through a scope check via more basic tests such as testing the stool for the presence of blood. And why is screening of paramount importance in the battle against colorectal cancer? Well, the answer really is very simple. It's because this cancer can be prevented through regular screening. Snip the polyp, prevent the cancer. If you like this, remember to share the post. And let's give a shout out to those who have just joined us again. Dinesh, RK as well, and Mr. Ali Khan, Leong Xiang, Performance Sports and Rehab as well. All right, thank you for joining us. Now, the other important area which I covered was lifestyle risk factors for colorectal cancer that we can empower ourselves to change and reduce our risk. To shed further light on this, I've invited two special guests, Mr. Derek Ong and Dr. Belinda Ting, to further enlighten us on the role of diet and exercise in colorectal cancer prevention and debunk some myths surrounding these again. Now, a little background about my first panelist tonight. Mr. Derek Ong is the principal dietitian and founder of Eat Right Nutrition Consultancy. He's an accredited practicing dietitian with the Dietitian Association of Australia as well as Singapore, and is the chairman of the Sports Nutrition Special Interest Group of the SNDA. As a fervent advocate for good nutrition, for good nutritional knowledge and preventive health education, Derek believes in empowering others with dietary insights, traveling on the job, anti-aging, as well as talking about chronic conditions such as diabetes, irritable bowel syndrome, and obesity. He's also a firm believer that healthy food should be delicious food. All right, let's bring on Derek as we discuss diet and cancer prevention. Hi, Derek.
Hi, Jonathan.
How are you doing?
Okay, great. How are you?
I'm great, fantastic.
Yeah.
Great to have you here. All right, let's go on to the risk reduction in colorectal cancer. Now, I talked about colorectal cancer last week, and one of the points I talked about was eating. There are certain modifiable risk factors which we can change. What should one be eating and or drinking more or less to reduce the risk of colorectal cancer?
Yeah, so I think that the evidence really points towards having a high fiber diet. Okay, so a diet that's rich in fruits and vegetables and whole grains for the antioxidants as well as for the the vitamins and minerals that come along with that. Yeah.
Mm.
So and as well as you know in terms of what you should be having less of, there's some evidence showing that it should be limiting red meat. Yeah,
Mm.
although there are some controversies about that. And then of course, alcohol intake, not to be too excessive there because that also may increase the
Mm.
risk of some cancers. Yeah,
Mm.
yeah. So so with regard to red meat, there is controversial
Okay.
some controversy there. Yeah.
Oh dear, because I actually love red meat. So is red meat controversial because it tastes so good?
Well, not exactly. It really depends on
Mm.
how the red meat is done. So, I think the controversy comes when when WHO said okay, increase of red meat consumption may increase the risk of cancer, especially colorectal cancer. They didn't go on to maybe perhaps look at the way the red meat is done. So, over in the West, red meat, like pork and beef, they tend to be like, barbecued and,
Mm.
it tends to be high temperature heating. And then you get these, the black stuff, we call it the heterocyclic amines. That's
Oh, the
the,
charring.
the charring, So,
Mm.
so that we know definitely increases cancer risk, especially
Oh dear.
colorectal cancer risk. So, whereas over here in Asia, we tend to eat our red meat quite differently. We
Mm.
have them in soups, stews, and stir fries, and so we don't subject our red meat to the same kind of heating methods. So, I think there is something to do with also the way it's being done. So yeah, so I think that there is definitely something there. So hence the controversy. Yeah,
I see. I see.
yeah.
Okay. Now I've noticed that, in fact, a couple of my patients as well, that
Mm.
they bring up the topic becoming a fad right now to take probiotics. Some
Mm.
people actually buy the probiotic
Yeah.
capsules.
Mm.
Others, especially the kids, they drink Yakult.
Yeah.
We'll come to that
Mm-hmm.
later on.
Yeah. 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 Okay.
Is supplementation with probiotics really necessary?
Yeah. Well, again, there's no strong evidence showing that supplementing with probiotics will actually prevent cancer,
Mm.
particularly colorectal cancer.
Mm.
Probiotics, you could supplementation is probably useful in certain circumstances. Let's say if you had a long course of antibiotics and you just want to
Mhm.
have a probiotics just to replace that, or
Mm.
if you have diarrhea, we know probiotics can pretty much get settle that, can
Mm.
pretty much stop diarrhea. We
Mm.
know that, but outside of that, there's no strong evidence. See,
Okay.
having said that, I think there's no harm in having foods that contain probiotics. So, for instance, like you mentioned Yakult or other sort of milk
Mm.
cultured drinks, or you have things like kimchi, kombucha, the milk kefir,
Mm.
very popular nowadays. On a daily basis, they've been traditionally in a lot of diets, in the world around the world. So I don't think there's any harm in that. Yeah,
Mm.
yeah. The other important thing to note about probiotics is you need to eat foods with prebiotics in
Mm.
order to in order to feed the bacteria. See, so a lot of people kind of forget about that, so they just
Right.
just supplementing probiotics, and then they don't
Mm.
take the prebiotics, which is food. See, so and these are foods that found quite a number of fruits and vegetables and all that. Yeah. So maybe at this point of time, I'd like to show just a short, well, about 2-minute video,
Okay.
so that can explain it in a little more detail. Yeah.
All right. Let's roll the video. Mm.
Basically, prebiotics are food for our gut microbes. Vegetables, fruits, whole grains, and legumes, like peas and beans, are among the best sources of naturally occurring prebiotic fiber. Ingredients in some packaged foods, like inulin and oligosaccharides, are also classified as prebiotics. In general, most people don't eat enough fiber. The average American eats about 16 grams of fiber per day, while the recommendation is 25 to 38 grams of fiber each day. Now, when gut microbes metabolize prebiotics, some produce short chain fatty acids like butyrate, acetate, and propionate. In the gastrointestinal tract, these short-chain fatty acids nourish the cells that line the gut and have been associated with reducing the risk of certain types of cancer, like colorectal cancer, enhancing calcium absorption, and relieving constipation and diarrhea. Short-chain fatty acids also enter the bloodstream and travel to other organs, where they can act as signals to communicate with the brain, as well as regulate the immune system and inflammation. Plant-based or high-fiber diets promote the presence of bacteria with a higher capacity to ferment prebiotic fiber, resulting in increased short-chain fatty acid production, which may contribute to an overall benefit to our health. Research on the effect of pre- and probiotics in both foods and dietary supplements is happening as we speak, and we're learning more all the time about their effects on health. Even though there have been some promising discoveries in certain populations, prebiotic and probiotic supplements aren't often given to patients in hospital settings because their health benefits haven't been conclusively proven. And despite being tested for safety before going on the market, some probiotic supplements have been associated with infections in case reports of immunocompromised patients. Alright, as a quick recap, the human gastrointestinal tract is home to trillions of microbes and their genetic makeup, which is called the gut microbiome. What we eat and drink directly affect our gut microbes, particularly foods and supplements that are categorized as probiotics and prebiotics. Probiotics are live microorganisms that have been shown to be beneficial to health. They're found in foods like fermented dairy products, as well as dietary supplements. Prebiotics are food components that microbes break down and use as energy, while providing beneficial compounds like short-chain fatty acids for our bodies to use. The gut microbiome is an exciting and emerging area of research, and we have a lot to learn about how it affects our health.
Wow, an excellent video. Very, very informative indeed.
Yeah.
Okay, thank you. That's great. Now, Derek, as you mentioned, red meat increases the risk of not just colorectal cancer, but also cancer in general. Should we then embark on the new thing which I hear, a plant-based diet?
Yeah, so there's been a lot of talk about that, and to be fair, there's a lot of evidence showing that actually following a plant-based diet does decrease the risk not just of cancer, but a lot of metabolic conditions like diabetes, and heart disease. But having said that, it's important to kind of be aware of how to do a plant-based diet properly, because a lot of people aren't aware that what are the plant sources of good protein. Yeah, so they need to be aware of what they are. So the legumes, nuts, and seeds, to have those. And we're talking about red meat. Red meat is high in iron. And so a lot of people on plant-based diets, they tend to get less iron because the iron in plant-based protein is more difficult to absorb. Yeah. So so when you're having a meal that's got the plant-based protein, it's important to have vitamin C. So usually you have a piece of fruit with the meal, and that vitamin C helps the body to absorb the iron, so you don't you don't end up getting iron deficient. So you've got to kind of do it properly. Yeah, so it's definitely got health benefits, but you've got to do your meal planning properly. Yeah.
Okay. I myself, I'm a carnivore. I love meats and all that sort of thing. I'm sure there are a few attendees right now who are also love to eat meat, and some of them, as far as I know, I see someone here who only eats meat and no vegetables as well.
Okay, yeah.
She obviously wouldn't own up right now, but I know who she is. So what would be the best way to start, if we want to try? What would the best way to start a plant-based diet?
Yeah, I'd say go slowly. Yeah, so don't suddenly overnight, just say, okay, I'm going to be just going to be totally 100% plant-based. So go slowly. Maybe try one meal a day, or 1 day a week, and then slowly replace the animal-based protein or the plant-based protein. Yeah, and then bearing in mind, the things like combining vitamin C with the food and all that. Yeah. So and being aware of the plant-based sources of protein. Yeah. So the legumes and nuts and seeds. Yeah. So I'd say go slow. Enjoy the journey. Some people go from full carnivore, omnivore, and then to pescatarian, which is like eating fish and seafood, and then before they eventually go to ovo-lacto, taking dairy and eggs, and then finally vegan. Yeah. So it's a journey. So don't rush it, I'd say. Yeah.
Okay. Okay, thanks. It's very informative, Derek. Stick around. We'll see you later for the Q&A. See you later.
See you later.
Okay, and if there are any questions, you can start typing in the chat, and we'll try to address it later during the Q&A session as well. Right now, a big shout out to Shirley, who's come in. Thanks for joining as well. Chloe, thanks for coming in again. Now, our second panelist, Dr. Belinda Ting, is the principal physiotherapist at Performance Sports and Rehab Therapy. She graduated from Columbia University with a master's and a doctorate in physical therapy. She has spent close to 10 years in California, working closely with physicians and surgeons in the Stanford area to rehabilitate post-op patients and athletes to achieve their goals. She's a certified strength and conditioning specialist with the National Strength and Conditioning Association and a certified health fitness instructor with the American College of Sports Medicine. Belinda is also a certified Pilates instructor and an advocate for using this method to enable cancer survivors to return to an active lifestyle. Join me to welcome Belinda as we now look at the role of exercise in how we can reduce our cancer risk. Hi, Belinda. Thank you for joining us today.
Thanks for having me, John.
How are you doing?
Good, thanks.
All right. Now, we're talking about cancer prevention as well as those who undergo cancer surgery. I'm sure there'll be maybe some cancer patients here in the post-operative state. Now, after a major operation, patients tend to be very, deconditioned, not quite their usual self. Mm-hmm. How do you get these patients back to their baseline, and how long does it take?
So usually post-op, we work mostly on their function first, right? So we have to follow strictly to the surgeon's protocol. Usually in the first 6 weeks, we are looking at tissue healing. So we're not supposed to be doing anything high impact or heavy lifting. So we're looking at just getting them up for a walk, working on sit to stand, transitional positions. So as simple as that seems, it's not so easy for these patients whose baseline has changed fitness level wise. So we start off with maybe the first week, 2 times 10-minute walk a day, if they can tolerate it. And by week 4, hopefully they get to a stage of maybe 2 to 3 times a day of 30 to 40 minutes of walking. So we basically start with that, and only after maybe 6 weeks, that's when they get surgeon clearance. And that's also when we start progressing them into more normal exercises. And that includes, besides the aerobic activities, that also now includes resistance exercises using TheraBand and physio ball and that kind of stuff.
Oh, great. Now, the other thing I've noticed is that a condition that is seldom talked about, and I do see this in my own cancer patients, is this entity of cancer fatigue that can occur both in the pre as well as in the post-surgical state. I've noticed that some of my patients, even in the pre-surgical state, they can have, for example, a low mood, low energy levels. Could you enlighten us further exactly what this is and how we can overcome this?
So patient education is very key for explaining what cancer fatigue is actually in order to get them to embark on our exercise programs usually. So we first have to make them understand that cancer-related fatigue is not the same thing as what you and I go through when we don't sleep well at night, or we didn't sleep in, or we went to the gym and had a hard workout. And I think a lot of people a lot of caregivers may need to understand this to encourage their cancer people in terms of exercises. So this cancer fatigue is much more severe, way more persistent, and it can even last for years after the treatment is over. So it's something that affects them physically, emotionally, and cognitively.
Right. Okay.
And basically, exercises have been shown in other studies to improve their memory and cognitive impairments and to help them improve their mood. It also helped them improve their energy and metabolism, also the cardiovascular health. A lot of the colorectal cancer patients also have decrease in muscle mass, and this is a good way for them to exercise. Also will help them improve muscle strength. But what's key with this fatigue is to educate them on how to overcome it. And a lot of times what we do is we have them log in which part of the day they're most fatigued. So a lot of times if they have issues with sleep disturbances, which is not unusual with cancer patients, what we find is in the mornings, they're a lot more affected. So this is when we try to adapt to what they can adhere to in terms of exercises. So maybe we'll shift their exercises programs to later on. We also use the ACSM guidelines, which is the American College of Sports Medicine guidelines. In my next slide, I would show you that basically the guidelines show that we need to be exercising 150 minutes per week and to adhere to a moderate intensity exercise. Or of course, if you're doing vigorous intensity exercises, it'll be 75 minutes per week. So the ACSM also encourages us to prescribe resistance exercises for these patients at least twice a week. And then, of course, the progression-wise is for them to be able to do a 45 minutes, 5 days per week program. And this is hopefully for them to adhere to forever. So it's a lifestyle change for these patients. And I think compliance usually is a bit of an issue. So it's really important for caregivers to understand some of this exercise benefits as well as fatigue, what this this cancer fatigue is.
5.5, very interesting. The exercising 1 hour a week actually decreases the risk of polyp development. Okay, now Belinda, you're a Pilates instructor. Now, people often consider running, walking as an exercise. So Pilates or taking a walk, what is considered an appropriate exercise program?
So if you look at, I'm going to show you a list of activities that will show you some light, moderate activities and some vigorous activities. But before that, let's maybe talk about the benefits of exercises in colorectal cancer. So it helps with sleep disturbances. It helps to decrease fatigue, as we talked about before. Of course, in general, it actually improves your cardiovascular health, helps with obesity, and improves your functional capacity as well. So it does change the level of inflammation in your body, which is what most of these patients are dealing with, whether it's pre-cancer or post-cancer, after cancer treatment. So now let's go to that list, and that will answer some of your questions. I think some people think that brisk walking may not be enough, but it actually is. And most of the literature out there do talk about brisk walking as one of the exercises that cancer patients should consider doing. Like I said, start off with the 10-minute, and if they're very fatigued that day, we always give them a lower amount to work with so that they don't feel as discouraged. So brisk walking is fine. You can see house cleaning is also fine, which is perfect for the circuit breaker times. And yard work is also okay. Vigorous activities are your fast cycling, your jogging, and your singles tennis, basketball. So some of this, I put it on the list here so that people in this period can look at it and see, what they can do.
I guess a lot of men can take up more house cleaning, I guess. Okay, Belinda, indulge me a little bit. Singapore is very, very car crazy, as you know. Is washing the car considered a good workout?
So washing the car is actually considered a workout, especially for cancer patients. But even for me, it would be considered a workout. It all depends, right, on how heavy of a workout you're looking at. So let's just say, if you want to be meticulous about checking, right? And what I will offer for most laymen is to to when you're doing all this car cleaning and house cleaning, what you can do is, if you can actually still talk to and have a conversation with somebody, then this is not considered vigorous. It's still considered minimum to moderate. But of course, if you have your smartwatch and you want to be using it and looking at your heart rate, so what you can do is you look at your maximum heart rate, and if you're wanting to work at a minimum to moderate level, then you're looking at 30 to 50% of your heart rate. If you're at that zone, then washing car would be your minimal to moderate activity level.
Okay, yeah. That's great. Now, the other thing, during this period, we're all supposed to be at home, there's not much activities like you talked about earlier on, tennis, even going for a swim, we can't do any of those. So what exercises can we do during this period, the circuit breaker, while we're at home, or supposed to be at home, to stay fit and lower our cancer risk?
So I can suggest some functional exercises you can do at home. Okay. And of course, later on, I will show on a video that would make it a little bit more clear for most people how you would get started. You can easily do squats, lunges, heel raises, just to start off with, just to name a few easy things to get to. Even sit to stand, if you do repetitions, that would also account as being exercises. But what I want to first draw to your attention is also what you need to look out for whilst you're doing these exercises. That will come to my next slide, where you're actually looking at some things that you need to watch for. If you're having a fever or not feeling well, and of course you are a cancer patient, then this is something you need to return to your physician for. So like I also mentioned, the time of the day is very important. Don't pick the times of the day that you're very tired, because then it's an uphill battle for you to actually complete your exercises. I would also not recommend heavy spinal loading, especially with cancer patients who might be dealing with osteoporosis or anything like that. And without close supervision, I at this point, especially during the circuit breaker, no one will be really supervising you. And this would be not something I would do on my own. Of course, the other things like cardiac issues and medications, hopefully that at that point you're cleared by your physicians. You already talked to them about some of these things you should look out for before exercising at home on your own, given the guidelines I've given you. So now to answer your question about what are the other things that you can do, I'll have this video played for you so that you can see how we can get started safely. So why I wanted to show this, because I want people to graduate towards an actual Pilates program, or maybe going to a Pilates class. But you need to understand that we have to actually nail the basics of Pilates. And after either surgery or having had pain, our bodies have different pattern of movements that are not that are mostly dysfunctional. So what I'm showing in this video, as you can see, I'm curling up. Anything with a big curl up like this, you can see it tilts my spine forward, and my pelvis is tilted more also. And that's causing more of your six-pack muscles to fire up. That's not really what we want. As you can see, what I did was I had this accordion. I had this movement where I had more creases in my shirt, and that's causing more deeper layers of the muscles to fire up. And that's what we're looking for. We need to nail this piece before we can actually progress in Pilates safely. And what's key about this isn't, I think people talk about core strengthening, and I think it's a little bit misleading because it's more core retraining. You're actually working on strategizing which layer of the muscle you want firing first, rather than working on those six-pack muscles that people think about all the time in the gym. So this second exercise I'm showing is an ab bracing exercise. In a Pilates class, I usually won't start this way unless I'm working with very deconditioned patients and patients with very dysfunctional movement patterns. So basically, you can see my pelvis is rocking as I lift one leg up at a time. And what you need to do is work on bracing the muscles without over squeezing. Over squeezing can cause also too much intra-abdominal pressure. That is not what we want to create by actually activating these deep layers. So I will not progress a patient if they're not able to lift both legs at a time. You can see I'm arching my back as I lift up both legs.
Yep.
That is not a, basically I don't pass the requirements.
Okay.
Yeah.
Great. That's you in the video, right?
Yeah, it is.
It looks very tough. Well, but perhaps something I can endeavor to try to improve my father figure. Okay. Come on, people have joined us. Big hi to Shirley, to FS, to JL Chu, and to Nancy as well, and Prabhu. Thank you for joining us. I hope you're learning from our guest speakers tonight. Let's bring on Derek now as we take some questions. Welcome back, Derek. Hiding in the shadows.
Yeah.
Okay, let's see. I noticed some questions relating to antioxidant supplementation. Some people mentioned stuff like taking not just vitamin C, but high dose vitamin C, black garlic, and drinking large amounts of alkaline water. Yeah. So what are your thoughts on these?
Okay.
Yeah.
Again, we don't have that kind of scientific evidence to show that taking high doses of antioxidant vitamins, so like vitamin A, C, E, is going to help to prevent cancer. If anything, high doses of antioxidants can actually throw your body's antioxidant system sort of off balance. So it's a very sensitive kind of system. So you don't want to have mega doses to kind of throw it off, and it could actually backfire. So that's not something I would do. Meeting your nutritional needs for those antioxidant vitamins through a good diet is probably a better way to go. As for black garlic and alkaline water,
yep.
Well, again, we don't have that evidence to show that it's gonna prevent cancer, or particularly colorectal cancer. But I guess no harm if you want to take it, but there's no guarantee it's going to work. Yeah.
Yeah. Okay. So that's the question. That's the answer to the question, and because I've also seen this alkaline water being available at some eateries as well. But when I looked at the evidence as well, it's certainly similar, where one should taking a small amount is fine. A large doses can potentially have a detrimental effects on the body potentially. Exactly, with alkaline water in particular, the calcium levels as well. Okay, this is an interesting question. Is insect protein beneficial? This is addressed to Derek, I think.
Okay.
Belinda, feel free to jump in if you have anything to add on.
Yeah, so insect protein has been touted as one of the alternative protein sources that's more sustainable. Yeah.
Okay.
So we know insect protein, it's definitely high in high in protein and fairly low in fat and saturated fat. So and it's got all your vitamins and minerals. So I'd say I think it shows it's quite promising. Yeah, and then there's some companies who are already making insect protein, but it's commercially it's just not widely available. But if we can get over that, call it the yuck factor, of actually eating like grasshoppers and ants and stuff. But there's some cultures that actually do eat insect protein, say in crickets and all that, and it's nutritious and it's sustainable. We just need to get over those certain kind of perception. But I think it's definitely the way moving forward.
All right. Okay.
Yeah.
Okay, Belinda, question for you. It's a two-part question. should you exercise while undergoing treatment? That's the first part. And the second part is how long after treatment is over can one resume back full exercise, full activities?
So maybe I'll answer the first part first.
Okay.
When you are going through treatment, I think it's with the literature out there, it shows that you should still be exercising. Actually, it actually buffers. It actually helps help you tolerate the treatment better. In fact, I've seen it improve some nausea in the patients, as well as improve their energy level. So to answer the other question, how long after treatment is over?
Yep.
Before we can go back to full exercise.
That's right.
In fact, they can pretty much go, it depends on what's full exercise for each one of us, correct? And I did mention after your 6 weeks post-op, we gradually move you into your normal exercises, start still embarking on aerobic exercises and resistance exercises at that point. But it depends. If you are doing CrossFits and that kind of stuff, I wouldn't be so anxious to go back to it. I would at least, and this is why I recommended Pilates. Part of the reason is because it's a mind and body workout, which I know with cancer, there's a lot of these cancer patients do get psychological distress, depression. And so some Pilates actually helps in those departments as well. So I would start with that. And if full exercise is CrossFit, then it wouldn't be anywhere near 12 weeks, if you ask me.
Okay, great answer. Yeah. Okay, but if I may add on from a surgical standpoint,
yes,
to that question, it's in fact it's not just exercise, but one should try as much as possible to refrain from heavy lifting. And what do I define by heavy lifting? Of course, it relates to the person's size, but I would take 10 kilograms as a rough figure. Too soon after the operation. In fact, I would suggest waiting about a month or so, a month to 6 weeks, because of the risk of developing an incisional hernia through the surgical wounds. Now, what is a hernia? A hernia means that the fascia or the strength layer of the tummy has actually opened up, not the skin, but the inner aspect, such that actually when patients strain, like they cough, or they strain themselves lifting things, they may find there's a lump in the tummy around the surgical wounds. Now that's a hernia. So you don't want that to happen because the contents of those could be the tummy fat, or in the worst case scenario, it could be the intestines, right? And the problem is that there's always a potential for the intestines to get stuck and lead to other problems if they're stuck in these hernias. Okay. Right, back to you, Derek. Now, a lot of questions about food here today. A lot of foodies around Singapore as well. Yeah. Now, someone asked about the Impossible Burger. Is that considered a true plant-based diet? For me, maybe even Belinda goes on that as well. I don't know.
Yeah, so the Impossible Burger is plant-based, and one of the distinguishing features about Impossible Burger, it actually contains something called heme iron, which is it just gives it its its red color. So when you cut it, it bleeds like beef. But we know actually it's heme iron. We're talking about cancer risk, right? Previously about red meat and cancer risk. It's actually heme iron that's been implicated in colorectal cancer risk, you see. Okay. So if you're going to be eating the Impossible Burger every day and you're going to expose yourself to the heme iron, it's going to be the same thing, you see. So in terms of risk reduction, you are not, having any risk reduction. In fact, if it could even increase the risk even more, see. So I'd say from a colorectal risk reduction viewpoint, I would treat the Impossible Burger just like any other beef burger. Yeah.
Okay. So essentially, it's moderation again, yeah?
Yes, yeah.
Moderation is the key.
Yeah.
There's another question about chia seeds. For you, Derek, are they beneficial? And another question was also about what are examples of foods that can provide the prebiotics?
Yeah.
Sorry.
Okay. Yeah, so I'll answer the first question about chia seeds. So chia seeds, they've got a lot of health benefits, rich in the omega-3s and omega-6 fatty acids. It's very high in fiber. If you ever taken chia seeds, when put in water, it kind of all swells up, and it keeps you full. So yeah, I mean, some people use it as a way to control their hunger, as a weight management tool. So yeah, and it's and for those foreign plant-based diets, again, it's another source of a little bit of protein there. Then there's foods that are rich in prebiotics. So basically, it's those foods that tend to cause some kind of gas and bloating. So it's your beans, your legumes, cabbage, broccoli, cauliflower. It gives a bit of gas and bloating because there's fermentation going on in the large bowel. But that's actually good because it shows it's feeding the gut bacteria. And then I just saw there was a study, the Singapore Chinese Health Study, showing that having more cabbage can actually help to reduce some of the risk of cancer, colorectal cancer. So there's definitely something there. Yeah.
Right. Yeah. I think cabbage really produces quite a lot of gas.
Yeah, that's right. Yeah.
Do you take chia seeds, Belinda?
Yes, I do actually. I make chia seed puddings. Actually,
oh, really?
My kids would do that as well. Yeah, it's very good.
Okay, let's just try that one day as well. Okay, Belinda, a question for you. The question posed was, what exactly constitutes cancer rehab?
So cancer rehab in my world, obviously as a physical therapist, is mostly exercise-based, exercise prescribed program. So like I said, I think in the initial phase, we are pretty much, it looks like we're just doing physical activities, just walking, working on breathing, because what we're trying to help patients with is trying to get them out of pain is one of them, and holding patterns. Sometimes with all the stress that they're going through, there's a lot of breathing, there's a lot of different breathing patterns that we also work with. And that's why Pilates is the other thing that we do, because that also accounts for the breathing issues. So basically we work on getting them stronger in terms of muscle mass, cardiovascular health. So in general, that's we use exercise as cancer medicine, which what's constitute as cancer rehab.
Okay, that's great. Okay, I'll take one last question. Derek, now, I'm sure a lot of us use this. Now, pepper, in particular, black pepper, brings out the flavor in a lot of things here. Is there a benefit to using black pepper for purposes of cancer reduction, risk reduction?
I'm not aware of any research showing that,
Okay.
But again, in terms of using of different sort of herbs and condiments, not just pepper, like a lot of, different things, rosemary and basil and all that. There's a lot of phytochemicals, a lot of good benefits to it that we still haven't found out. So I won't be surprised that there really is something in black pepper that could have certain sort of antioxidant effects. As to whether it reduces cancer risk, well, there's a whole separate thing altogether. Yeah.
All right. Okay. There's one last question from last week which I wanted to pose to you this week, and see what our cooking habits. Maybe Belinda uses this as well. Does the use of low quality cooking oils increase our risk of cancer?
Low quality cooking oils. Well, I think when it comes to cooking oils, you've got to look at two main things. First of all, a couple of things. What's the smoke point? Okay, so if you're going to be doing high temperature heating, you want an oil that has a fairly high smoke point, so it doesn't break down and cause produce all the free radicals. So you want to have something that's fairly high smoke point. So some of the lower quality cooking oils may not search about high smoke point. So that's a downside.
How about olive oil?
Olive oil, 100% olive oil has a fairly high smoke point, so that's fine. So
that's what I use.
Yeah, 100%. Extra virgin, just leave it, for salads, not really for like deep frying and all, please don't use.
Right.
And then also it's about the fatty acid composition. So we're talking about cancer. It's actually an inflammatory condition. So underlying it, there's a low grade inflammation, just like diabetes or
Cancer
obesity, cancer. There's all this inflammation going. You want to find things that will reduce inflammation. So you want to find that oil that has high in maybe omega-3s and less omega-6, which tends to increase inflammation. So things like, for instance, canola oil, that may be good. And then also that also has a high smoke point as well. Yeah.
Right. Okay. Yeah. So clearly Belinda believes in that. Users keep fit as well, not just exercise, but also with olive oils as well.
Yeah.
Okay, great. Any last words of advice for our viewers, Belinda? Passing.
So I think somebody was talking about how she does her housework and still can sing.
Yeah.
So I think you saw that as well. And actually singing is an exercise too. You're using your diaphragm. Diaphragm is one of the 4 core muscles that we work with, and Pilates as well. So I think it's added exercise. So you're actually doing 2. It's not a bad
2 in
idea.
1.
Yeah.
Derek, any last words of advice?
I'd say probably, it sounds very cliche, but a balance, variety and moderation in terms of the diet, not just eating one food all the time, and mixing and matching different food groups and all. I think really that really is the best way, combined with exercise as well, of course.
Great. Okay, excellent. I couldn't agree more with the advice that both of you have given. Okay, so thank you. So for those questions we didn't manage to answer, we'll try to take some later on. But thank you, Derek and Belinda, for joining us today. Take care and stay safe.
Thank you.
Bye. Take care.
Bye.
Wonderful sharing from our 2 panelists. Excellent. I learned so much today. Now, after last week's talk, I've actually received several questions about the discomfort experience, or what do you feel during a colonoscopy? Well, I can answer that question actually from a personal standpoint, having undergone a colonoscope check myself. And I can tell you it's very different from performing the scope to actually undergoing the scope itself. It's very, very different. So, but I had the support and care of an anesthetist for the procedure, and I was asleep before it started. When I awoke, there was no pain in the back passage or in the tummy. I had absolutely no recollection of the procedure, and overall, to me, it felt like I had undergone a nap. Now, a reminder again, these are some of the things which I talked about last week. If anyone develops these what I call as red flag symptoms, please visit your doctor for review to see if further tests are required, even during this circuit breaker period. We don't want you to undergo treatment and, like in the next slide, wear a bag where possible. And if you are otherwise well, screening remains the cornerstone in the battle against colorectal cancer.
Is that my classic question?
Yeah.
Colorectal cancer or polyps actually has no signs or symptoms in the earliest stage, and not all blood in the stool is actually due to piles. So these are the screening tests that are available. For those who are well, do remember to go for your screening tests after the circuit breaker, whether it be a scope, which you can see from the video over there. That's what the internal aspect of a scope looks like. But more than what we can see during a scope is that if we see any polyp, if you look at the other video, what you will notice is that if there is a polyp, what we can do during the scope is that we can actually remove the polyp. And as I mentioned, even in the previous week, if we can snip the polyp by removing the polyp, we can actually prevent the cancer. Now, our supporting partner, Singapore Cancer Society, has kindly provided 50 complimentary test kits to us. These will be available at our clinic at McPherson Mall for yourself or your loved ones to collect. Should you collect on their behalf, please remember to bring along their IC so that their eligibility can be checked. That means those who are 50 years and above. And you can do this after the circuit breaker is over. All right. Well, this more or less concludes today's live stream. I trust it was useful for everyone. I know it was for me. I've learned a lot from Belinda and Derek today. Thank you for joining us today, and I thank you for your questions and comments. As usual, if you like today's live stream, do give us a like and share for upcoming sessions. If you have any topics of interest that you would like us to cover, do drop us a message or an email. Remember, colorectal cancer is preventable, treatable, and beatable. In the meantime, stay home, stay safe, and stay healthy. See you in the next session. Take care.